I'm Dr. Gabby.
And I'm Dr. Kieran.
And we're here to talk about preventative health.
You've probably heard the adage, prevention is better than cure. So we're doctors, so of course we agree with that, but let us tell you why preventative health is actually important to you.
Almost half of Australians have one or more chronic conditions. Those are the ones that tend to last for a long time and generally need treatment or management. For example, diabetes, heart disease, and some cancers. This is really hard for the individual, but also for the healthcare system. But for many of these chronic conditions, we can actually do things to prevent them from developing in the first place. I'm talking about things like stopping smoking, moving our bodies, and staying in the healthy weight range. It's troubling to read statistics on obesity these days. 1 in 4 children and 2 in 3 adults are overweight or obese. And it's all to do with our lifestyle. We eat the wrong foods, we eat too much food, and we aren't moving enough.
Mental illnesses like depression and anxiety are actually chronic conditions too. You might not have them forever, but they're things that we will need to treat and manage in the long term to help you get better and to prevent them from coming back. It's fairly simple to adopt with just a few small steps. So step number 1, eating a healthy diet. Just like Gabby said there, it's really important, but also moving our body every day is one of the most powerful tools we have when it comes to looking after our health. Make it something that you enjoy, and even if you can only do it for 10 minutes, just do it for that 10 minutes. Ideally, you'll get your heart rate up and it'll be weight-bearing exercise like walking, tennis, or even dancing, because that's good for your bones as well.
Preventative health means being proactive about your health, even when you aren't sick. Come and see your GP regularly so that we can keep on top of preventative health activities. Things like vaccinations, cervical cancer screening, and looking out for heart disease. If something has changed and isn't quite right, come and talk to us about it. Most often, getting help sooner rather than later means we have a good chance of turning things around. Please don't put off seeing your doctor. Your health needs to be a top priority. And if you live regionally, like I do, book a telehealth appointment if there's going to be a wait so we can at least get the ball rolling.
The last thing I want to talk about here are drugs and alcohol. When we're struggling mentally and emotionally, it can be really easy to reach for these things because they pep us up and they make us feel a little bit better in the short term. But what we do know, Gab, is that in the longer term, they're not that good for our mental or physical health. But when you're feeling like that, that's when you need to reach out to someone. Whether it's a mental health professional like me, or it's a partner or a mate, we need to tell someone what's going on. Please know it's never weak to speak when it comes about your mental health or your physical health.
100%, that's great advice, Kieran. Healthcare is a team sport. It's a partnership between you and your medical professionals and your family and friends. So let's look out for each other and for ourselves and get in early, because prevention is definitely better than cure.